Hello and welcome to the Future of Dentistry event. I'm your host, Marilee Sears, and today I'm with Chris Gibbs, CEO of the Florida Probe Corporation. So happy to have you here with me today, Chris. How are you doing?
Great, thank you. Glad to be here.
It's nice to see you. You know, I've seen your face on email, but it's nice to actually see you. It makes it feel kind of personal. So I hope everyone else feels the same way if they're able to see our video here. But Chris, before we jump into the slides and hear more about the Florida Probe and what is coming out right now with VoiceWorks and all the things that all the exciting things that you have been working on and that are available, I wanted to find out a little bit more about you and your history with Florida Probe and kind of what, you know, that whole background, if you don't mind telling us a little bit more.
Sure. So I've been involved with the Florida Probe now just over 20 years. Florida Probe has actually been around about 24, coming up on 25 years now. So Florida Probe was a product that was actually invented at the University of Florida back in about 1985, and it was started as a research project to allow really accurate probing data to be fed into a computer and to improve the quality of research that's being done on perio-related treatments and perio-related products. And the frustration at that time was that manual probes depended a lot on the actual person probing. And so if your research study didn't have people properly trained and you had a lot of different locations, how could you really know that the data was accurate or that these products were working? And so Florida Probe really was created back there, and why it has the name Florida Probe was to give credit to the University of Florida where it was invented. So a big part of what Florida Probe was and still is used in the research community to be a really accurate and consistent data collection device. And I would argue that years ago we really believed Florida Probe was a probe, and all these years later, here we are 24 years later, Florida Probe still has a probe and we're still software. But a big part of what we really are now today is getting a patient motivated and to get a patient to say yes for an asymptomatic disease. So maybe we started off as a probe and we ended up as a way to get more yeses early on in an asymptomatic disease, and how to communicate that properly with patients to get them to say yes for all the right reasons.
That's actually really interesting that you just said that, because that's a great segue into kind of the next question that I had, which is, you know, how do you see the Florida Probe changing the face of dentistry, both, you know, over the course of the 24 years up until today? And I think you touched on it really well there, that it's not just the probe, it's changing the systems within the practice. And so do you want to go into that a little bit more and share how you've seen it changing the face of dentistry?
I mean, I'll be as open with you as I can. You know, we work with a lot of different offices that are at all different levels of where they are. We work more with a general practice than other types of office. So usually this is a GP office, a general practice that has 2 or more hygienists, and they're coming in at all different levels. So some of these offices are at the very top of their game. They've kind of had a really good periodontal program, and adding Florida Probe is just kind of the icing to the cake. We have other offices that are probably really struggling, that haven't been doing a good job in the accuracy or the consistency. They know and want to do a better job, and this is the opportunity to have a piece of technology really help them move forward. And so you have a lot of different things you're trying to fix or improve in those different systems. We work with the dentist, and interestingly enough, from a personality standpoint, the dentist is sometimes the best dentists in the world are really highly focused people, very myopic and focused, and it's hard to get them to be really good at dentistry and really good at running a business. And at the end of the day, we are talking about an expensive periodontal probe versus a probe they may already have or software they may already have. Why would I buy something else? So how do we prove that this system pays for itself or does better dentistry or really does both? And so interestingly enough, it lots of times it does prove to be a really hard thing to make any change in the office at all. But the nice thing about buying a piece of technology like the Florida Probe is that if you're going to make a big change, lots of times it's easier to make a change around technology. The patient's experiences change. They get a printout to go home. They listen to the computer. They have kind of a new experience that helps them understand why this office is now doing a much more focused job than they were doing before. ironically, they'd been telling the patient for years they had bleeding and they had problems and they needed to get them a higher level of care, but the patients kind of had the brakes on or were listening only to their insurance company. And so it's been really fun to watch what the changes are in dentistry over the last 20, 25 years and about how technology has helped that. We've watched, offices that never had a computer now. It's kind of the standard where we're trying to bring a computer into the operatory, not just to the front office. So that part's been neat. The other part that's really been interesting to watch overall is that, what's happening for the empowerment of hygienists in offices, that the quality of care that a hygienist is delivering, it's not about just cleaning teeth or just being friendly and the real dentistry is done over by the dentist. There's a lot of offices where, the amount of dentistry that's being done by the hygienist is amazing, and the quality of those experiences with the patient are being improved by intraoral cameras and filmless x-ray and oral cancer screening, and obviously for periodontal charting, Florida Probe is doing some amazing things to get patients to say yes. We used to think about periodontal disease 20 years ago about, well, it's about bad breath and losing teeth. For dentists, we lose teeth. It's a problem for our restorative world. And now we're talking about saving lives. So we're not just talking about cleaning teeth and making them pretty and white. We're actually talking about reducing heart attacks and strokes and respiratory disease and diabetes. And, the list just goes on and on about having this infection. So the value that a hygienist can produce is way more than just the money side of this discussion. It's about the quality of care, and maybe you save somebody's life. Maybe you save somebody's life and improve the quality of life that they have while they're here. So dentistry, I think, has grown in its value. It's grown in its level of expertise, and it really does, in some cases, take technology to take things to the next level.
Yeah.
That's what we're excited about for Florida Probe.
And that's where the Florida Probe leads the way. So if you want to, I love that you have this getting your patient to yes, because that is always something that has been a struggle, and I'd love for you to share how the Florida Probe helps with that.
Yeah, we'd love to kind of share some secrets with you that we've picked up along the way. Whether you buy Florida Probe or not, or implement a product like this, I think it's good to know what these secrets are about communicating with patients. I think it's really important to immerse your patient in a co-diagnostic experience. If the patient shows up broken and then you fix them with some magic stuff and send them home broken again, that kind of level of interaction is different than if the patient shows up, they're in the chair, they're on the team, it's you and me against the disease, and that process can happen during the exam. If they go to sleep in the chair and you create this wonderful spa treatment experience where they just go to sleep and they wake up and something's done, we miss that opportunity to do this co-diagnostic effect where they're listening in, they're part of the team. I'm going to take that and make sure their home care is translated to things that are going to improve what matters. One of the things we're doing is we're providing a colored printout for patients at the end of the day. What if the printouts were actually about the patient instead of just the dental team? What if the patient could read the charts? What if they we're understanding, a little bit of red is indicating where the problems are. A lot of offices are still using paper charts, and so sometimes it's hard to read, sometimes it's hard to share that information with a patient. Those are designed just for the dental team. So once you get used to actually sharing a chart with a patient, I think you start to allow the improvement of that technology to take place. I'm a visual learner, so if you don't show me why a 4 is worse than a 3, it doesn't really digest as well as you just saying 3 and 4. So some patients like me have to see it, and so maybe you have to hear it, see it, take a chart home, watch a movie, whatever it takes to kind of get them to yes. So on the screen there you see a printout, and here we're seeing a close-up of one with more disease. At the bottom we're trending the last 3 visits for this person, so you can see overall what's happening, but on a site-specific level you see little red down arrows around 215. As I'm circling here on the screen, you can see a 4, 5, 7. The 5 and the 7 are actually getting worse compared to it. So it's not just what's happening today, but what's happening on the big picture that I think patients really do pay attention to. This is a disease for a lifetime. A lot of times a toothache kind of has the idea that it's a disease for the weekend until you fix it, and then, the problem is solved. And really, it's hard to mentally switch gears for a disease like periodontal disease, where it's, a disease for a lifetime like diabetes or something would be. And we're never going to cure you, but we are going to manage it. Number 3 is watching patient education movies. a lot of patient education movies may already be in the office, and the problem with them is sometimes they're 10 or 15 minutes. Nobody actually has time to really implement them in a busy routine. Florida Probe has 4 little 1-minute movie clips so that they're so short you actually have time to use it right before the exam starts, or if you diagnose them with disease right after it ends. And so there's 4 different ones. If you only have time for 1 or 2 of the movies, you can click that. You need to have a clear protocol in your office, like, boom, this patient's been coming in every 6 months. Today we found a periodontal program. Exactly how do we treat that patient? So if the dentist doesn't know, I can promise you the hygienist doesn't know. If the hygienist doesn't know, I can promise you the patient isn't going to be capable of saying yes without a plan. So I think the protocol has to be clear. The cool thing about dentistry is that hygienists have a lot more tools at their disposal than they did 20 years ago. So now there's antimicrobials, and there's lasers in certain states, and there's all this amazing things that are happening for hygienists, and it allows them to not only earn more money, but create more value, but of course save more teeth. The question that comes up in a lot of trainings is, tell me what your protocol is now. Do you have one? In almost every office we talk to, they do have a protocol. But when you start dialing into that protocol and you start asking questions like, okay, the patient has 5 more bleedings or 20 more bleedings, or they have their first 4-millimeter pocket or their first 5-millimeter pocket, at what magical tipping point is that now a perio patient? And a lot of offices, once you actually start to ask the hard questions, it becomes this amorphous kind of gray area, and nobody knows exactly, well, okay, now it's a perio patient. Well, let me check with the doctor. And so if you don't know, I can promise you that it's a lowest common denominator effect down to the patient. Well, maybe I really don't need treatment. And it's really nice to have Florida Probe in there to make it more obvious when, okay, this is definitely a perio patient. So it's important to know your tipping point. It's important to work as a team together and practice some scenarios like, okay, this is obviously a perio case or not. Number 5, make sure that every patient is getting the best treatment regardless of perceived affordability. Would you recommend the same care if this was a family member? So I was in an office recently, and the doctor was like, oh, don't worry, they don't need to come in every 4 months. We could probably, they'll be fine with another prophy. And I said, you know, the chart that we were looking at on the screen was very similar to the dentist. He had a couple of 4s, and, you know, it's like, well, just out of curiosity, how often you get your teeth cleaned for free? You do it for free at your office. How often do you get your teeth cleaned? Well, he got his teeth cleaned every 3 months. And this was for a non-paying patient. I mean, he's getting the dentistry for free. So ironically, you know, why would you offer your patients anything less than the best care? And a lot of this has to do with insurance company and other decisions that I have a joke with an office where the kid in the chair, 21-year-old kid, makes a lot of money as a computer programmer, has ripped jeans. And the implication was that this patient didn't have any money because his jeans were ripped. And the ironic twist, these were the $500 jeans. And so just making an assumption that this patient couldn't afford it, they didn't always get the best treatment options, or maybe there was, well, they can't afford it. So I think always to give the best opportunity of care.
And I want to jump in here for just a minute because I completely agree. I think so much of this is actually subliminal. We don't even, it's unconscious. Do you know what I'm saying? It's not that the hygienist looks at his jeans or the dentist looks at his jeans and says, well, he can't afford it, I'm not going to present it. But it's those unconscious decisions that as a hygienist or as a dentist, they're saying, okay, are we going to present this? No. And, you know, someone could come in with a Rolex and be driving a brand new Mercedes and say no to periodontal treatment, and someone driving a 10-year-old car and being very much a blue-collar worker could say yes to it. You never know how people view their health despite the amount of money that they have. Different people view it differently. And that was a really big lesson for me to learn, is that I learned that I used to kind of pre-qualify who would want treatment and who didn't want treatment. And I wasn't doing it intentionally, but until you get a program like this in place, a system like this in place, you realize that you're doing that and you're giving a different level of care to different people. And it's a really slippery slope to be on. Like you said, it puts you into that whole gray area of when do you treat. And I mean, for patient care, it's so much more important to have something like this. And then also for liability reasons, it's so important that you have something like this where it's consistent care, consistent treatment, consistent diagnosis, so that patients are hearing a consistent message.
Yeah, you're right. It's a lot about perception. I think this world, I mean, as kids we grew up and you know, a fact is a fact is a fact. And really, it's more about perception in some ironic cases than about facts. And so it's my perceived value, right? It's, hey, I get my
Yes.
hair cut every month and I spend $100, you know, and I'm only going to the dentist twice a year and I'm spending $100 per visit. So where's my value? If suddenly I need to go to the dentist twice more per year, it's another, let's say it's a perio treatment and it's $125 for a perio maintenance visit or something, and I'm 2 extra times that the insurance does or doesn't cover. If I compare that to maybe spending money on a haircut or something else that doesn't impact my oral health or my health overall as much as maybe a haircut or something, it's about value and the perceived value. So as soon as a patient says no to treatment, I think that's your clue that, uh-oh, I could do a better job to raise the value. It's not that the value isn't there, it's that I have an opportunity to close that gap. And the picture we're seeing on the screen right now is a diagnostic form that if you say, hey, this patient has slight periodontal disease, we create a plan. And so a lot of times for a patient, when they come into the office, they automatically are wearing their toothache hat. If it hurts, it's broken, I know to fix it. And that's the whole world they've come from. If I've seen a yellow tooth or a cracked tooth, a cosmetic, you know, billions of dollars of pretty happy, successful people have pretty teeth. So that has kind of, you know, skewed our understanding of what value is, but also about how easy it is for a patient to say yes for a tooth whitening, but maybe to say no for something called root scraping that sounds scary and yucky. So a lot of times just having a plan, like here on the screen, you can see estimated treatments. It's going to take 3 visits to bring your mouth under control. We're going to put you in a 4-month recare. Here's what we did today. We're kind of just setting up the future for success. A year from now, I may not remember that I said yes to all this stuff, and it's nice to go back and say, oh, remember the plan, here's what we said yes. And the patient signs off. You were saying about subliminal motivators. There's nothing more powerful than signing a piece of paper because it implies importance. If the only thing the office ever has you sign is a credit card machine or a payment slip, it almost feels like the focus is on money, when of course that's not true. But if a patient says yes to tooth whitening and no to something that's going to affect my health, then it's a lack of value systems. Maybe it costs me $150 more to do a cleaning, but what does it cost to get an implant? What does it cost to get a smile makeover? What does it cost to get a heart attack? What does it cost to die? So I mean, I'm not saying if you don't do this you will die, but I am saying that it does directly affect your health. And patients that say no, it's good to make sure that they sign no, that they understand there are consequences to saying no. We would never have you say, sign something for a tooth whitening. But for a patient who refuses to get x-rays, who refuses us to let us do good care, what are our options? Well, we have to take a really hard look at, are those kind of patients we really want in our practice? For patients in perio, of course, I think it's just the opportunity that we've missed our opportunity to educate them. 80% of the population will get this disease so severe that they'll lose a tooth in their lifespan, and that has triggered all the host response and other problems.
Right.
But 3% seek treatment. So everybody gets the disease and nobody knows it, and that gap has to be closed by education. And for some people, just signing a piece of paper and going, let me think about this, take it home, is kind of that critical step to go, oh my gosh, it is important. And just because I said no today doesn't mean you're off the hook. It means every time you come in, we're going to ask you to do the right thing. It's just at least you see there's a plan, at least you see that there's a diagnosis. And for some patients, they have to see it in writing. They have to have the
yes.
they touch. Number 7 here, we've got an opportunity to run a risk analysis for patients. Some offices, this is kind of the buzzword in perio right now, is risk analysis. Risk analysis for a lot of things in dentistry, but for perio, it's not important just to figure out the risk of what if you get it and you've never had it. What's your chance for reinfection? So what happens when I clean you up and you're healthy and now it's been 2 years later? What's your chance of getting this? Well, it's affected by a lot of things that people don't automatically know about. So maybe my smoking habit does affect this. Smoking is bad by itself, but this is why, if you haven't already thought of quitting smoking, this is your dental reason. What about medications? What about the past disease I had? What about family history? We don't get to check a box, when we're born about picking our parents. So some of these things, we don't have a choice about. It's our DNA. But now that you know better, we're not going to wait for your teeth to fall out. We're going to be more aggressive when we see the early signs of periodontal disease for you. So you have to come back twice as much as the guy sitting in the chair next to you that doesn't have these challenges. And for a lot of offices, I think it's the first time that they have really educated a patient about those different things. So here it's based on their age. Every time you do a probing in Florida Probe, it automatically feeds the raw probing and charting data, the bleeding data, into the chart to adjust it. And it automatically changes on the fly. So if this person is marked a medium risk and today I figure out they're a smoker, boom, it automatically puts them into the high risk category. What does that mean for my protocol? Well, high risk people I see every 2 to 3 months. You know, low risk people I'll see every 6 months. So right away, for an office that feels like, ooh, the tipping point isn't obvious, now I have a tool that says, here's the science behind why you come in every 2 months versus every 6 months. And sometimes it just is easier to deliver bad news when we have a third-party kind of non-biased thing, in this case a computer program, to help you go, ooh, it's a clear case of high-risk patients, and we're going to see more often. Number 8 is about improving your scripting, making it personal, giving it a sense of urgency. So a lot of times a patient in a loving, caring kind of dental office is, don't worry, we'll watch it. And that belittles or kind of de-emphasizes a pretty serious disease. If they had oral cancer, would you say, don't worry, we'll watch it? No, we would biopsy it and send it off immediately. And I think a lot of times that window of opportunity to catch it is at those earlier stages when we have more options and when we have a better chance of success. And if you spend too much time saying, don't worry, when you finally do need that, you've kind of built up some complacency. You need to know words like infection. You need to know action words in your scripting. And Florida Probe just calling out the data out loud, saying warning and danger, is a critical part to go, oh my gosh, it's serious.
Yes.
And allows that to happen. Create a high-tech and memorable perio exam experience. Was this memorable? I've been on the airplane sitting next to some 50-year-old guy that has $50,000 smile makeover. What do you do? What do you do? And he doesn't ever remember in his life having a periodontal exam. Now, I'm sure he's had one, but the experience wasn't memorable. So when you get perio treatments, you do this, oh, I don't know. And he doesn't know. So when that finally comes to that decision where he has to make a choice about his perio thing, let's hope that he trusts the dental team enough. Let's hope that he just says yes. But I'm nervous that without that memorable experience, he doesn't understand it, he doesn't have the ability to say yes sooner or more often. So a lot of times with a color printout that you go home and a talking probe experience, that was memorable enough to make a difference and to improve your home care and other things that we're going to ask for later. For the office itself, do you know your hygiene numbers? We get into group practices, and they are the numbers police. They know every office is doing what. And, you know, what do you care about in your office? I'm not just talking about the money side. I'm really talking about the quality of care. What percentage of your patients are in perio recare? I always like to run a little test for offices. Tell me what the number is before we go look. And a lot of offices think about 30–35% of their patient load should be in recare. If 80% of the patients have some disease, maybe 30–35% is actually really low. When we get in and run the numbers, it's closer to 4 to 7%. And so people say, oh my gosh, that's horrible. Well, it is a huge opportunity to really improve that. So I think offices that don't track their production don't really know where they're at. And the assumption is, oh, we're doing a pretty good job. And maybe that's true. But maybe that's a huge opportunity to really look at what kind of dentistry is actually being done and then what's actually being built. We look at a lot of offices where the numbers, they are actually doing a really good job about the quality of care, but it's all being billed out as pro fees or it's being billed out improperly. And so that's a huge opportunity to maybe take a new look at whether or not it really does fit the definition of a pro fee or really it is more of a perio maintenance. And you can just decide tomorrow to do a better job, or sometimes a piece of technology like this really helps explain to a patient why we're suddenly taking an improved focus on that. It's not just the improvements in research to tell us this disease is more important than it used to be. And so, in effect, these tools really help you make a paradigm shift in the office and transfer that process to the patient where they feel like, okay, this is why, and this makes sense, and I understand now, and you did tell me about the bleeding, but now that I see it, I'm ready to do something today. And that happens all the way from the hygienist, up to the dentist, as far as that protocol and that routine that's in the office.
And I really like with the color charting, first to a patient, 1 millimeter doesn't sound like that much, but to actually get a diagram and they can see how each and every millimeter really does make a difference in,
Uh-huh.
the stability of their teeth. And then the other part is having that as an ongoing conversation. Because again, as a hygienist, and I know it's the same with dentists, sometimes we're only talking to people about periodontal disease when we find something wrong. But if they're seeing this chart on a regular basis, so patients, it's easy for them to forget about periodontal disease if everything's kind of going right. So then they start slipping from their 3 month or 4 month periodontal maintenance. Well, nothing's been going wrong, so I'm going to start going longer now. Whereas if you're continuing to have that conversation with them every single time, this is why it's important that you're coming in, Mrs. Smith, every 4 months, because look at how stable things are. That's why you're coming in this frequently, is because look at where it was, and you're continuing to stay stable here, and we need to keep you here. Instead, having that conversation is so much better than waiting, the patient's kind of sliding, going, they haven't talked about periodontal disease lately. I don't think I need to come in so often. And then the disease comes back. And you know what I'm saying? It's constantly this battle back and forth if you're not having that ongoing conversation about their health, their periodontal health.
Right, right. Yeah, I think it is hard for some patients to really understand that this is a disease for a lifetime, and it's never just magically cured. It really is managed. And that as we get older, our immune systems don't work as good as they used to when we were 18 years old. And we do have stresses in our life that come up and down, kind of out of the blue or for other reasons that are outside of our control. So I think it is important to have patients in a routine where when something does, fall off the wagon or you do sense a problem, that you can catch it right then. I think it's hard to remember that gingivitis is the only part of this disease that's reversible. And basically that happens from a 3 to a 4, that little tiny window. But once they actually lose the bone, unless they're going to do major surgery or something else, that doesn't just magically grow back. And once we've lost that ground, it's hard to get that back. So that window of opportunity is pretty small, and it's pretty powerful to be able to catch it right then and have these tools. And, if you have a mouthful of 7, you're looking at a whole different scenario to try and keep this patient's teeth for a lifetime. I think the other thing is, too, that just the ability to do implants or other things has given us more tools, but that, patients are living longer. So just in the last, 20 years, the lifespan is slowly creeping up. We may have that creeping back down thanks to diabetes and our sugar-filled diets and fast food things, but I really think patients are more have the ability to think long term. If your parents had dentures and you think you're just destined for dentures, maybe there's people that give up early. But I think that way of thinking is an older set of thinking, and really people do expect to have their teeth for a lifetime. There's some neat studies out there about people that live longer because they have their natural teeth and other things that we don't always correlate teeth with lifespan and other things, but it is really an important part. There's that saying, never look a gift horse in the mouth, and it's talking really about teeth and being able to judge the health of a horse or the age of a horse based on their teeth. So really the teeth are a neat window into the body's immune system. If the eyes are the window to the soul, the mouth maybe is the window into the health and the gateway to the body's health.
So true.
I'd love to do a quick demo for you. So I've got the software up on the screen. I've got the little voice window running in the corner. We brought up a patient that was already in the system, and so we have an opportunity to go in and look at an older chart or create a new chart. As a time saver, you can bring up an option called Carry Data Forward, which allows you to actually bring a ghosted image of the old chart and just chart what's changed. Usually we're charting, quite a bit of stuff that's changed, but it allows us to kind of do a chart either way. I'm tempted to actually maybe even do one from scratch, so maybe we'll switch this.
I think we have time if you'd like to. If it just adds a couple minutes to do it from scratch.
Yeah. I've got the headset here, so just so people that are watching, this is a brand new product for Florida Probe called VoiceWorks. It's a wireless headset. It uses 2 little USB keys, so you can have different users, different hygienists entering data from one headset, and then you can move the one headset to other rooms. A lot of offices that have 2 or 3 hygienists probing at the same time would have 2 or 3 headsets. This one allows you to use your manual probe and enter the data in so that a second person in the room isn't needed. there's some things about this headset that are really unique, that really are nowhere else in the world, that this headset is designed for a noisy environment. It's designed to work through a paper mask. It's designed to have the data called out so the patient hears it out loud, has that co-diagnostic experience we were talking about. But I get to still kind of be the good guy. I'm the healer and the educator, and the computer is the, oh no, look what we found. And together, we're kind of getting a patient to yes. So I just turned the headset on, and start listening. Okay. No.
Entering pocket depth.
Got it a little bit loud. Let's see if I can lower the volume. 212.
212.
I think I chose the wrong visit. Oh, we were going to start a new visit. I apologize. Let me start a new visit for a patient. So I'm going to go to the new patient screen, and we are just going to start a new patient. I'm going to put in my last name and put in my first name. We like to mark male or female, and we like to mark the birth date. If you have Dentrix or something, you can link over the missing teeth data, and you can have that data automatically put in. Start listening. Okay. No.
Entering pocket depth.
Remove third molars. Crown.
Crown.
212.
212.
Distal bleeding.
Bleeding.
323.
323.
112.
112.
212.
212.
Recession 2.
Recession 2.
Interproximal bleeding.
Interproximal bleeding.
213.
213.
Distal bleeding.
Bleeding.
214.
214.
Bleeding.
Danger 8. 1. Bleeding.
Undo 3. Pus.
Pus.
213.
213.
Half tooth bleeding.
Half tooth bleeding.
Recession 3.
Recession 3.
212.
2. Midline 2.
213.
213.
Half tooth bleeding.
Half tooth bleeding.
Implant.
Implant.
Next. Missing.
Missing.
Next. 213.
213.
Recession 3.
Recession 3.
214.
214.
Half tooth bleeding.
Half tooth bleeding.
Hyperplasia 1.
Hyperplasia 1.
222.
222.
Crown.
Crown.
Recession 4.
Recession 4.
Furcation 1.
Furcation 1.
Interproximal bleeding.
Interproximal bleeding.
213.
213.
Jump to 3. Interproximal bleeding.
Interproximal bleeding.
Jump to 4. Suppuration.
Pus.
Jump to 9. Half tooth bleeding.
Half tooth bleeding.
Jump to 15 lingual. 212.
212.
323.
323.
Healthy.
212.
Normal.
323.
Healthy.
212.
Repeat 3.
2 midline 2
212.
212.
Stop VoiceWorks. So at any time you can kind of interrupt it and take a phone call or talk to the patient about it. If you're saying non-charting words like, turn towards me, how you doing, bite down a little bit, those kind of words are not charting words, and they are normally kind of ignored. I should have been using my paper mask, so I apologize. I had the volume up way too loud at first. But anyways, you kind of get a feel that you can just kind of, as fast as you can talk the data in, you can put the data in. You can mark missing teeth on the fly like you saw. I did mark the 4 wisdom teeth out when we started. Halfway over, I did mark like a crown and an implant, mark a tooth missing. So you can kind of mark the dentition on the fly. If you're using a product like Dentrix G5, the data automatically passes in of the missing teeth already. So it's kind of cool to be able to have that data come in. But even if they don't pass it to you, you can just put it in a matter of seconds. Anyway, so you can see about as fast as you can probe with 2 people, we can put it in. You hear the warning and danger. I have little warning and danger things indicated at different levels. So this office does scaling root planing at 4 millimeters or deeper. And then from 6 and higher, you can have a danger. I actually didn't put a danger in. Let me do that right now. Start listening. 214.
214.
727.
Danger. 72. Danger. 7.
So there's a case where you hear the danger, and maybe we do scaling root planing plus we scored in our antimicrobial. Maybe we do scaling root planing plus we're going to use the laser at the danger site. So you can trigger the word to be different than the word danger. It can say a noise, or you can say arrestin, or you can say anything you want. We had an office that makes a laser noise when the probing is ideal for use, with the laser. So if you get more than 5 laser noises during the exam, then it kind of gives you an opportunity to know, ooh, you're a perfect candidate, for our laser treatment. And so really it's about doing the probing and charting as fast as a 2-person team can do. But at the end of it, does the patient say yes? I mean, do they hear it, see it, take a chart home, maybe watch a movie? If they say no, do we have other tools to get them back over to yes? Can we run a risk assessment? Can we run a patient movie? What does it take to get a patient to realize that this is so important, that it's more important than bad breath, or more important than, the things that they're saying no to? What do we have to do to make them realize it's important? So anyway, that's just using the headset. We do have the ability to put the data in from, a computerized probe. So this is our new dolphin handpiece for people that haven't seen it. This is a one-time use disposable. And then it's got an implant-grade titanium tip, and the data goes in at a much higher precision and accuracy than with your manual probe. But at least for offices that are happy about their manual probing, they have a fast, kind of hands-free way to put the data in from a headset.
That's fantastic. I am so impressed. I love the system that you put together. I love the specificity, like hyperplasia, things that I just would not have expected to be thought of are here, and how quickly it responds is incredible. And when I had a chance to speak with you a few weeks ago, you'd also told me that it does different languages.
Yeah, so let's do that real quick. So I click the options button, I hit the sound. We were in the British female, so just for fun, let's do Spanish. So we're in Florida, of course, and there's a lot of Spanish-speaking people where English is not their first language, and here you are trying to have a very confusing conversation in the first place, and it's not even in their local language. So let's do a couple in Spanish. So now anybody that speaks English can be instantly translated to 18 different languages. You can even switch male or female. So if I think the female, I'm a male, obviously, and if I want the female to be more soothing or whatever, I can pick that voice. So we'll switch it for Spanish. Start listening. Start VoiceWorks. I think I accidentally, did I turn it on? Oh, sorry. I turned the headset off by mistake.
Don't worry, I do it all the time with my Bluetooth. I totally understand.
Start listening. 212.
2, 1, 2.
213.
2, 1, 3.
Bleeding.
Sangrado.
412.
4. Arco mandibular. 1, 2.
213.
2, 1, 3.
Bleeding.
Sangrado.
Pus.
Pus.
217.
2, 1. Peligro. 7.
Stop VoiceWorks. Okay, so there you heard it just for a second about the Spanish, and obviously you could do German or Chinese or other ones as well. So it's just kind of a fun way to really communicate properly to a patient, even in their native language. You can do the little printouts in Spanish, education movies in Spanish. The take-home sheets are in Spanish for the patients as well. So it really is kind of a multilingual tool, so it's kind of fun.
That's fantastic. So not only does it provide communication barriers sometimes between the patient and the patient and the dentist or the patient and the hygienist about disease, but also uh, can help communication barriers just because different languages. I mean, I don't know of someone who hasn't had it happen where someone comes into the office and they don't speak the language and trying to, especially if the patient is uncomfortable and they're doing like the whole like jumping thing, and you're trying to tell them that you're doing, having them, helping them to understand what it is that you're doing and that you're not trying to hurt them. This communicates a lot about that.
Yeah, and I think it says a lot about the office that goes to that extra effort to do something to make it, it's not that you're showing up broken and we just do a magic dentistry and send you home. I think there's a lot of maybe Korean patients or Spanish-speaking patients or others that want to go to the best office in town and still need to have that communicated properly. And there's something magical about doing it during the exam that gets me to listen in and realize, what level, am I going to need some treatment? Should I get ready and prepared to say yes? And in a way, these tools really at least start the conversation from the patient. If you remember that statistic we talked about, 80% have the problem and 3% seek treatment on their own. How do we change that dynamic so the patients are going from 3% to 80%? How do we close that gap? In a lot of ways, when you hear the computer saying, warning, danger, pus, you can't pretend there isn't nothing happening, and you can't pretend there isn't a sense of urgency. Now, ironically, if the hygienist does the warning, danger, pus out of their own mouth, they can actually create a scary experience that makes the patient almost shriek away. And so in a weird way, the non-biased third-party computer, hey, look what I found, not, hey, I don't like you, an emotional experience that really can't be done by a two-person team. That a computer can, in a way, get away with or motivate or do. So in a weird way, technology can do things that just can't be done by the two-person human team. Plus, the computer can automatically compare back to the last 5 visits and tell me what's better and worse, flag it as we go, and give a color printout that really helped me go, okay, yep, it's time to do something. Let's get started today. Thank goodness you found it. Thank goodness you're in my chair. Thank goodness. And so a lot of this is really good news that we caught it early and good news that we have the options and good news that we got started today. So I think the conversation can always be a positive one. It's up to you to frame it. And I think at the end of the day, sometimes we're only as good as the technology and the tools that we implement into our busy offices and our busy day. And these tools help maximize your efficiency. And at the end of the day, really get more patients to say yes. For an asymptomatic disease, it's really important. It really does make a difference. And so offices really are realizing that they're not just treating teeth or they're not just treating disease, they're treating people, and people need that extra education and time and energy to understand complicated diseases like gum disease.
Absolutely. And what you were saying is that this actually can and does build trust, because what it reminds me of is when I take my car into a mechanic and they say, oh, your car has a problem. I may or may not trust their word, but when they hook it up to a diagnostic and they give me a computer printout of this is what my car needs, I never question that, right? It's like you said, it's that third party that all of a sudden it's like, well, why would I question that? This is what it shows. And so it somehow gives that, oh, well, I don't need a second opinion. I don't need to question whether or not I need this. It shows I need it. And so the visual, the third party, all of that is so important in getting patients on board and motivated about receiving care.
Yeah, I think that's an interesting word, and the comparison that you're making now actually to like the car thing. I mean, I think of, in a weird way, the Prophy exam is almost like going to the Jiffy Lube and getting an oil. And here we're trying to talk you into something different. Here we are trying to do something that says, oh, well, here's the synthetic oil change, and this is going to last a gazillion miles more. And in a funny way, that makes a neat correlation really with the dental office. No hygienist is trained to be a salesman. There's nothing to do, the sell word is a 4-letter word that nobody wants to talk about. And as a patient, I don't want to go into a dental office or a healthcare professional and ever feel sold. I do want to know that I'm at the best guy in town and they've got the best equipment. So in a funny way, I do really want to have whatever you're doing kind of built up to a level of quality and expertise and all those things. And really with this technology, when you can see an asymptomatic disease, you don't need to see a picture of a toothache when it hurts like crazy. I'm begging you at 7:30 that morning before you open, can you come in early and treat it? So there's no problem when you have a motivator like pain. But a lot of times for a disease like this where you just don't see it or you just don't understand, or you look in the mirror and you see, at first it seems like, well, a little bleeding is maybe normal. Maybe I've seen 25 Listerine commercials this month that says, maybe I can just fix this myself at Walmart. And now, I don't know what this is. Let me think about it. And I think it really helps to hear it, see it, take a chart home, watch a movie. And for some people, it's the layering effect that says, well, there's 5 or 6 things saying yes, instead of maybe the old method we use where if you were lucky to overhear what the numbers were, then, of course, you figured out there was a problem. So in a way, it's not really about selling. It's that I want to really believe that I'm at the best office and they have the best technology and all of those things. It just makes it easier to say yes when that opportunity is given to you. And of course, it's not just about getting yes the first time. Once we find a perio patient, they typically need to be managed over a lifetime, and it's about keeping them motivated year after year, so that once we get here we are in Florida and we joke about sinkholes, that there's no reason to build your dream house over a sinkhole. And in a lot of ways, that's kind of what periodontal disease is that we're at these dental offices that do beautiful restoration work. But if it's built over a bad foundation, it really, it's not going to hold up long term. And so doing great dentistry is really about having the perio component taken care of. And that starts at the earliest stages, I think, when you have the most options.
Absolutely.
Patients back every 3 months for their perio maintenance has obviously got more opportunity to do those restorative things. And once they believe in the foundation, they have more opportunity to invest in the cosmetic side as well.
And just to bring up again, because I've had these conversations as a hygienist, and another thing I love about the Florida Probe is when you're talking about risk factors, I am not saying to the patient, well, your age is a risk factor. The computer is saying, the program is saying that your age is a risk factor. And there's a difference in that. Does that make sense? Someone could be, I might feel uncomfortable telling someone that their age is a risk factor, but there's nothing offensive about telling them that the computer program shows that their age is a risk factor. Does that make sense? So all of these things, it just makes the conversation so much easier, because I do think that's a big reason why periodontal disease has such a gap in the treatment, is that people don't know how to approach the conversation in a way that doesn't offend the patient and in a way that doesn't make the office possibly look neglectful. And so it can be hard to have that conversation, and this makes it so much easier. So much easier.
Yeah. And to be honest, the problem with periodontal disease is that it's really complicated. There's a lot of moving parts, and maybe you were okay 6 months ago, and now the game has changed. Maybe you started smoking. Maybe you're on a medication to dry mouth. Maybe, and until you're asking those questions over and over again, how would you know? And so there are weird conversations that can develop that I think that need to be had, that are maybe weird in the uncomfortable sense. But if you think about, hey, this person's been told to quit smoking 100 times, why do I have to be the one to get them to stop smoking? Well, maybe the generic conversation about smoking isn't the way to start the conversation. Maybe the opportunity is, as the dental professional, what is the dental side of this conversation that only you can really bring to the table? They're not going to get from a TV commercial or something else. So it's not about getting them to quit smoking. It's about, hey, let me do the form right now. So you're at a medium risk already based on the actual disease level. I found out you're a smoker today, and boom, you've got a higher risk score now based on your age. If you're diabetes, boom, now you're a high risk score. So we've got to get those 2 items managed to be in the best interest of your health, and this is that opportunity.
Well, Chris, I really appreciate you taking the time. I am so impressed with what you have created, what your company has created. And the name of this event is The Future of Dentistry, because that's what I want to promote, is what is going to make dentistry better and what's going to make it better for both the professionals and the patients. And that's why I was so happy that you agreed to be interviewed and to showcase the Florida Probe, because I think it's just one of those leading edge products that does that. It makes it better for the profession and it makes it better for the patients. And that's just a win-win. That's what we want. So thank you so much for your time. I really appreciate it.
All right. Thanks again.
Okay.
All right. Bye.
Bye.